Trauma in specific setting is talk about how to be assessed for first aid for the patient with trauma and how to we manage it, how we assess with primary survey and secondary survey, and all the kind of trauma that can cause a life emergency case. The course is running for the doctor and nurse and Timor Leste healthcare. This is so important for the trauma training, especially in our country, because we have a lot of struggling in healthcare. So it is so helpful to elevate our knowledge and our ability and refresh our knowledge so we can give a proper healthcare to our people.
These courses help us how to attend the patient from the start to like ABCD approach. Being a professional health worker is very need this course because they are in their real situation. How do they do their patient when have trauma in their accident or like car accident, motorbike accident? When come our facility, what we do?
The course was very informative and practical. One decision that stood out to me was a hands-on training case study where we learned first aid at the University of Peace. It really helped me understand how to respond effectively in real-life trauma situations. I learned a lot, but one of the most valuable things was how to quickly access and stabilize a trauma patient in critical situations. The training also emphasized teamwork and communication, which are essential in emergency care.